Welcome to My City Talks, the podcast that shines a spotlight on the individuals and organizations around the globe making a lasting impact on the health and well-being of their communities. Brought to you by the nonprofit My City, My Health. Each episode will bring you inspiring stories from changemakers, health advocates, and community leaders who are challenging the status quo to create healthier, more equitable environments for everyone.
Thank you so much, Corey. Welcome, everybody, to our very first My City Talks. Our subject for tonight being HIV awareness. My name is Larry Twitty Jr. My pronouns are he, him, and his. And in a second here, I will introduce my guests here and allow them a quick opportunity to tell you a little bit more about themselves. Earlier this month, we acknowledged World AIDS Day. Since the 1980s, when the HIV virus was first discovered, there have been several advancements related to the treatment, the education, and even the perception related to the virus. And so tonight's conversation is about furthering that discussion, furthering the discussion on HIV. And our goal is to educate and even relieve some of the stigma that might still be surrounded related to the virus. My guests to the left of me, I've got a couple community advocates. We have Alicia Mercado and Destiny Smith. Alicia, if you don't mind, can you just tell our audience a little bit about who you are and your background?
Sure. My name is Alicia Mercado. My pronouns are she, her, ella, suya. So I'm bilingual, Puerto Rican American. I'm originally from Florida, but I've been in Iowa most of my life. I have a social work degree and have loved serving immigrant communities in Northeast Iowa for most of my profession. I used to be a case manager for people living with HIV for 4 years before I moved into this role, doing education around HIV and STIs and stigma. Thank you for having me here today. I'm a bit nervous. So.
Destiny?
Oh, hello. I'm Destiny. I'm a little nervous too. I ain't never in this type of space. I'm Destiny Smith. I'm born and raised in Iowa, been here all my life, never plan to leave, truthfully. I'm an HIV advocate. I have been living with HIV. It'll be 7 years the day after Christmas I was diagnosed. I am an author, blogger, mother, advocate, influencer. I do a lot of my advocacy online, so through Facebook, TikTok, Instagram, LinkedIn now. All of those good things. I travel around the world, share my story. I think that's it.
Destiny, Alicia, thank you so much for introducing yourselves. So let's kick things off. Okay, so there have been modern advances within HIV medication that have made it so that folks can test, and please correct me on the language if I misspeak here, but basically there are many individuals living with HIV that have a status of undetectable and untransmittable, also known as U equals U. So I'm curious, talk to me a little bit about how U equals U has impacted HIV prevention and stigma. Who would like to take that one on?
Want to go first? I can. I know you can only say so many things.
Yep.
So.
Okay, so thank you for bringing up U equals U.
No, she doesn't need it.
It's an important message we want people to understand. The first U stands for undetectable, and the second one is untransmittable. And so when you are undetectable, somebody living with HIV can be undetectable when there's very low levels of HIV in their blood and around the rest of their body. And then to be that when you're undetectable, HIV is untransmittable through sex. And so just that alone can impact the stigma around living with HIV. If people understand that somebody is untransmittable, undetectable, ideally it would have a positive impact on stigma.
Let me see if I understood the question correctly.
Yeah, so I was just curious to know how U equals U, or being, or I guess being undetectable, how that affects, or how that has an impact on, how people think about or feel about HIV, the stigma around it.
So I feel like for uneducated people, U equals U doesn't really concern them in a sense. It doesn't matter because they don't think about it, and because they don't understand HIV, they don't believe in U equals U. But as a woman living with HIV, it's very freeing because I can do what I want when I want without thinking about passing this virus to somebody else. I can do the same things as everyone else, and I don't pass what I have as long as I continue to stay on that treatment to be undetectable.
Yeah. Okay, and I'm learning. Again, I'm probably the only person in this room that doesn't have some sort of public health background, but I'm just curious, so how is it is it transmittable, I guess, in other ways, if you're at that status, U equals U?
What, ask the question again. What do you mean, like, can you transmit it other ways if you're undetectable?
Right, because I'm learning in real time here. So and so we mentioned that it's not transmittable through sex, but
I would say data-wise that's a very good question. But because they don't have the data for other things, you can't really say absolutely. Like, because they are now in America, they've been doing it in other countries, but now in America they're doing the data on like breastfeeding. So now. We have data that shows if a mother is undetectable, her child cannot contract the virus through breast milk. So I feel like as the years go on and they keep getting the research for certain other things, we'll learn more. But as of now, it's just we know 100% sure. When it comes to sex, if you are undetectable, you can't pass this virus. When it comes to feeding your child through breast milk, you can't pass this virus. And I think those are the only two things they really have the numbers on right now.
Gotcha. Okay. So talk to me about PrEP. Talk to me about PEP. Explain to me what those things are and its importance in its importance as a preventative measure against HIV. And also, I'm curious to know what the availability is for those things in Iowa.
The easiest way to understand what PrEP and PEP is PrEP is basically like, let's say, the birth control for HIV. So this is a pill or an injection that you can take every single day that helps you lessen the chance of contracting the virus. PEP is like Plan B for HIV. So if you have been in contact with a person that is living with HIV, you can get this pill, and it will also take that chance away of you contracting the virus, but you do have to get that pill within the first 72 hours for it to work effectively.
Okay. So, and did you have anything to add to that, Alicia?
So along with the pill that you would take daily for PEP, she talked about the injectable, and that is a long-acting injectable. And so that potentially could be taken once a month in an injection or every 2 months, depending on your visit with the provider and what is best for yourself and your body. And then I wouldn't need to add anything more for PEP, just if you believe that you've been exposed to HIV in different forms, you can request PEP from like an emergency room or from a provider to start the medication within 72 hours, like Destiny said.
So are those medications, are they readily available in Iowa? Are they pretty easy to...
I feel like they're very accessible. The problem is a lot of people just don't know about it. If you're not connected to this space or people living with HIV, you don't hear a lot about it. A lot of people will talk about how they go to their primary caretakers and they've never heard of PrEP and PEP, and they don't understand how people can get it. But you are able to go to places like the Project, the Quad Cities, and you're able to get this for free. Like, you don't have to pay for it. Your health insurance will pay for it. So it's very easy to get. A lot of people just don't know about it.
Can I add? So we also have prepiowa.org. You can go to that website and get more information. And we have a PrEP navigator that works to help connect people to the medicine. We have teleprep, and so you can actually access medication and those services just by telephone. And so if your insurance doesn't cover it or you need other supports, the navigator will connect you with different programs to try to get it covered and make it accessible either at a local pharmacy or mail to your house, different ways. So there is support out there from a navigator.
Alicia, I'm glad that you brought that up because that kind of jumps into my next question, which is, what case management services are available for folks living with HIV in Iowa? And if you can share some of the free resources as well, that'd be great.
Sure. Through federal funding, it's called the Ryan White funding. There are free medical case management services for people living with HIV. Some of that includes transportation assistance to doctor's appointments. Some programs can write for grocery cards, so you can get assistance buying groceries. There's also a case manager who you meet with as frequently as you need to talk about your medical needs, your other needs like rental assistance or assistance paying utilities. If you need help paying medical bills, case management can help connect you with those services. You can also get dental insurance, medical insurance, assistance paying for mental health services. So that's just some of a really long list. And all of that medical case management is free for people living with HIV. And so none of that is. There is a income guidelines, which is 500% federal poverty level to qualify for free medical case management, but all of those are free.
So break it down for those of us that aren't mathematicians here. So 5%.
500%.
500%
Yep.
Poverty.
Yep, federal poverty level.
So what does that mean?
So every year, the federal government comes out with a poverty level scale.
Okay.
And so they say if you're an individual, a family of one, then 100% of federal poverty level is this amount of income for the year.
Gotcha.
And so you look at your family size, go up to 500%. If your income is less than that, then you would qualify.
Wow. Okay. Okay. Thank you so much.
Yep.
I want to talk a little bit more about stigma and misconceptions regarding HIV. And guys, I remember watching Captain Planet, and a cartoon, back in the day, and this is right around the time when again we were learning more about HIV, learning more about AIDS, and a kid wasn't allowed to play basketball, or they teased them or something like that, right? So I know that things have changed. The perception around HIV and the stigma and things like that definitely has changed. But still, there are misconceptions that still exist. So talk to me a little bit about how misconceptions about HIV impact people's willingness to get tested or receive treatment for HIV.
We can keep saying that stigma has changed and it's not around, but to me it hasn't changed. It's still around and it's still very bad. A lot of people who stigmatize HIV are people who are uneducated about the virus. But I feel like it messes with people who don't know their status and they don't want to get tested because there's so many words that people use when it comes to the virus that they don't want that sticking to them. There's people who won't go into nonprofits like the Project because it's a place that works with the LGBTQA community. So they don't want to walk into this space because if somebody sees them in this space, that means that they're gay or that they are open to all of these things that they may not even be open to, but they just want to be here to get tested. But because somebody's seen them in here, that means that this is what they do. And I think a lot of people sometimes when people stigmatize, they don't even know that this is a word or what they're doing. It's just how they're programmed. So when So when we talk about stigma, I guess it's just we have to, not that it's our jobs, and I'm saying our because I'm a person living with HIV, to teach people first language. If we're already speaking that language, people will learn it themselves and they'll start speaking it themselves. So just focusing on different ways to talk about HIV so everyone's catching on to it.
Yeah. Thank you.
Mm-hmm.
Thank you. Well, that brings me to my next question. How can healthcare providers and community organizations work together to improve HIV prevention and care, improve the perception around living with HIV?
I think doing stuff like this, meeting people where they are, starting the conversation, letting people know that there is a conversation, that it hasn't went anywhere. Worldwide, we are supposed to be ending HIV by 2030. In my own head, in my space, it's not going to happen because people aren't having the conversation like they need to be. So doing stuff like this, if you guys weren't here right now, you would probably be sitting at home watching TV or doing anything else that wasn't talking about HIV. But because you saw this on the internet or you got invited from a friend, now you're sitting here learning things that you probably didn't know at all. So just meeting people where they are so they can be a part of the conversation.
Yeah. Thank you.
Yeah, I would second that. Also, if you're a provider, whether it's a mental health provider or in the medical field or in community corrections or substance use, I would challenge you to invite people so you can learn from them. Invite community, invite professionals who can teach you, and try to learn about the stigma, social determinants of health, learn about PrEP, and if you can prescribe, learn how to prescribe. Start prescribing. There are people out here to support you so you can learn that, so you can serve the patients that you're serving. I would say that have conversations. Whatever you learn tonight, have conversations with providers that you know. Whether you have nursing friends, yes, we know they can't prescribe, but they can, take information back to their offices. Have conversations with providers, with people you know about what you've learned. See what they know. And if they don't know something and you don't know, go together and learn. Seek the information. There are people around the state who can offer that support to you. I would also ask that you include the topic of HIV and information whenever you're having health fairs at your organizations, whenever you're bringing in educational topic or people to speak for the community or for your providers. Invite people in this realm so they can speak and more people can learn.
Yeah. Very well said. Very well said. So for Iowa specifically, are there challenges or are there barriers to receiving equitable access to treatment or access at all? Is there anything that's happening within our state that's holding folks back from getting what they need to still live healthy lives with HIV, whether that be, I don't know, political barriers or stuff within the medical community, I guess?
Okay, so Iowa is unique, along with Minnesota, in compared to the rest of the United States, that 27% of people living with HIV live in our rural communities, okay? And so that is a very high percentage compared to all the other states, except Minnesota. And so that makes us unique, extra different, unique barriers. So some of that is just distance from providers who can or will prescribe, and also distance from medical HIV specialists. And so you have transportation, you have time, you have needing to get off of work, which then potentially you don't get paid or you get a mark because you missed a day. So pure distance, but also the policies in the systems that we all navigate aren't conducive for meeting the needs of all the people in the community. And so people living with HIV are a diverse community, and you know that systems were not set up to effectively serve everybody. And so those are huge barriers. And then there's social norms and social policies that play a role in treatment and prevention and access. So some providers don't believe people living with HIV live in their community. And so some of those social norms and beliefs can be barriers. So,
Destiny, have you experienced any barriers or any challenges to? And we just met, I don't know. I know you're kind of from. I kind of know the area that you're from, but
I feel like personally, I haven't. I was pregnant when I was diagnosed. I had a very good team. I didn't right away start off going to see the doctor for my diagnosis because I didn't want to believe it. But I can say one thing about Iowa is they're very straight on. So you can find out, and that's why I love the project. You can go in there and get tested and find out your status, and if it just happens to be positive, you get the help the same day. You meet a case manager that day, you get connected with your doctor that day, you can meet a counselor that day, they help you get your pills right away. So I feel like here it's just up to you, and that's not everywhere. And just like she said, in rural areas, it's not that easy because they're so far away from these doctors. So I feel like it just all depends on where you're located and the resources that's available for you.
Okay. I'm going to take just a quick pause here. Does anyone have any questions? And if you don't, that's okay. I can keep rolling. But go ahead, Jasmine.
I'm just curious for folks that have been diagnosed, I guess two-part question. Folks that have been diagnosed, what are some things that they should be prepared for? And for folks who have been diagnosed, receive treatment, what are some things that they wish they would have done first or earlier when they first got diagnosed?
So the question was, what were some symptoms that you may have noticed?
Not symptoms,
Or, I'm sorry,
just more of like, what are some things they should be prepared for?
Oh, what is,
Or
okay, I'm sorry.
Like, what does support look like
Yes.
in the early stages of being diagnosed? And what are some things people wish they would have done earlier?
Gotcha. So I'm just repeating so that we pick up on our podcast. But the question is, what are some things that we need to do early once receiving a diagnosis?
And then support-wise, I feel like support-wise, I'm not gonna say up to the person, but it's kind of like, what was your support before you found out that diagnosis? Is kind of how it is. I tell people all the time, I have two different support systems. So I have the people that were in my life before this diagnosis, and then I have my red ribbon family, which is the people that I have met because of this diagnosis. So other people living with HIV, doctors, nurses, I probably never would have met if I didn't contract this virus. So a support system is something that we build. So to be able to be in these spaces, be around the right people, connecting with others. And then what was the second one?
Like, what do people wish they would have done sooner when they find out?
I think sooner is to just get the treatment right away. That hearing that you are living with HIV is very hard to hear, so a lot of people shut down. And once you shut down and you fall into that depression, you don't want to believe this isn't me. They got this wrong, like, let's run 100 more tests and let's figure it out because it can't be me. So instead of you getting that treatment right away, you're trying to distract yourself and figure out ways for this not to be you at all, when in all actuality, that treatment can just change your life. Once it took me about a month to get on my treatment, but once I did, I was undetectable within 3 weeks. And I've been undetectable since. Nothing in my life has changed except for me popping a pill every single day, and that's it. So if I would have done it sooner, I wouldn't have had to fight that battle in my own head with myself and isolate myself from so many people because of how I felt inside, instead of just getting the help right away and learning that, I can actually live with this, and I'm still the same person I was. I just have to maneuver a little different and remember to take a pill. So.
Can I add? So, like Destiny said, she was tested in a clinic that was able to provide services immediately. She got her diagnosis. She could have, seen a case manager, was connected very quickly. So ideally, once you're given your diagnosis, ideally it's in person, then you can be offered a connection to case management right away, and be given options as far as medical providers, so specialists who you can choose to go to. Of course, in larger cities, that's more likely to happen. If you're in a rural community and you've had to wait some days to get your results, or you have to find a day to be able to drive back to that clinic to get your result, it could take more time to get connected to all of the services. Sometimes people aren't ready to talk to a case manager immediately, and sometimes they are ready. And so you can be hopefully or ideally prepared to meet some people that could become your team of professionals that can support you and offer you options, and from there. So.
Thanks. So we kind of talked about this a little bit, but I want to just dive in a little bit deeper. How can we better engage medical professionals and our community about HIV education and awareness? I like what you said earlier, Alicia, about, hey, if the patient is looking for the answer, and if the provider doesn't necessarily have the answer, go together, and figure it out together. But are there some other ideas that come to mind, or some things that you would maybe wish to see as far as ways that the medical community and the community in general can work together to provide more awareness and education around HIV?
I would just say actually bringing the medical people and the community together. We have a lot of these spaces, and I appreciate these spaces, but sometimes when we come into these spaces, it's still separate. So there'll be a space like this, I go speak in, and it's only doctors and only nurses. And then I'll go to another one, and it's only community. And in all actuality, if we can't all sit together, we're not actually working together. So to be able to have these spaces, but have all of us in one room so we can actually talk together, that's something I would love to see.
Yeah.
I would also add dispel myths. If you hear people talking about, something about HIV and you don't think it's quite right, or that's a myth, speak up and say, hey, where did you hear that? Ask questions and curiosity to see where they're coming from, and then have a conversation to kind of dispel some of those myths. And if you can, look on your phone, go to stophiviowa.org, and you can learn facts and information from that website if needed together.
I feel like you two are all we need to reach that goal of eliminating HIV by 2030, right? If we all, took those steps, and if we all became advocates for one another, that goal is definitely attainable, and sometimes it just takes for a couple people to speak up. So thank you so much. I just want to open it up again to our audience here for any questions you might have for Alicia and Destiny.
I have a question.
Sir?
Yes.
Sir in the back? Yeah?
Corey. This question is primarily for you, Destiny. I know you are an HIV advocate and influencer on social media.
Mm-hmm.
Can you touch on how you've experienced some of the myths on social media, around HIV awareness? Have you seen anything as far as misinformation, and how do you handle that? And how has your experience been trying to bring truth on social media around HIV awareness?
Since I went viral a few times, I have got a lot of misinformation in my comments and things, or being on live. Just depends on what the day is and how people feel. But a lot of misconception is, as women living with HIV, we contract HIV from men who are DL. There is one advocate who that's her story and she's sticking to it, and I love that for her. I can't tell somebody else's story. But that is a very big misconception. Not saying it doesn't happen, it's never happened, but to say that it's something that happens with every single person, we can't say that. So that's one big one.
And I just want to clarify for those, we're kind of speaking coded language here.
Sorry.
So when Destiny's mentioning a guy that's DL, what she's referring to is a man that is also being intimate with other men, but not necessarily out about it. So.
So I guess that's one of the biggest ones, and then a lot of people still think that the way the virus can be transmitted is me touching her, or if somebody happens to go to the bathroom after I go to the bathroom, or I've had people ask me, do me and my children use the same towels and the same utensils, or is there like this separate line in my house for me and then for my kids? And I live normal just like everybody else. I mean, whatever we want to say normal is, if that is a thing, we are that. I just take a pill every day. And some of us, we don't even take pills. They take injections that they don't have to think about the pill. So yeah, I think it just depends on the day and how people are feeling. Because, I mean, there's more. We can talk about the stigma in the comments, but we won't do that. And I guess my first few years of advocacy, I handled it really well. I didn't reply to stuff like that. My last couple years, though, I've been clapping back. Somebody got to do it. Just so they know, and I like to clap back because they continue the conversation. And some of those people have apologized to me. They've come back around. They've learned things. So it just depends on how you yourself maneuver those conversations.
So, and I'm just going to ask Destiny, I mean, you put it out there, you're an influencer, so that means you're active in social media. How can our audience follow you so that they can learn more about your story and learn how to be better advocates for folks with HIV?
All of my social networks are my first and last name, Destiny Smith. For some reason, God created a lot of Destiny Smith, so if I don't pop up at the top, if you just put HIV behind it, it'll pop up like that. I'm very big on Facebook and TikTok. Instagram, I'm working on it, and I've been kind of blowing up on LinkedIn. So literally all of those networks is just my first and last name. YouTube too, first and last name.
Okay, so Destiny Smith on YouTube, TikTok, LinkedIn, IG.
All those good things.
All the Facebook.
I'm everywhere, literally.
Everywhere. All right. Awesome. Any more questions? Sir?
Yes. I want to ask the lady who's a mental health clinician. Are you a clinician?
Nope, I am not. I am the lead regional health specialist and a health equity educator with New Cara Capacity Extension.
Well, that puts things in order there. Okay. The question I wanted to ask in regards to the disparity in healthcare and looking at marginalized populations. I hear clinicians working, but when they're addressing people from marginalized communities, sometimes they're not culturally attuned.
Yes.
And even some of the training and following through the educational journey, you're taught to do things a certain way, and then when you deal with a different group of people, a different culture, it might not work like that. Mm-hmm. So my question is, do you see any changes coming or any help for the people that are already at the lowest, being marginalized, and then you're dealing with a disease? I think we need to do something different.
Mm-hmm. Yes, I would agree with you. What I can tell you for Iowa is that I lead a team of 5 regional health specialists that work across the state that try to educate providers. And we talk about topics of stigma, health equity. And then I also am on another team, a health equity team. My coworkers are back there. And so we are doing a lot of work internally with our coworkers and externally with subrecipients who provide services for people living with HIV. And so we try to reach providers in the communities to help them have experiences or learn about ways that they can change the way they talk, how they can arrange their waiting room, what they can put on their walls or on their tables. Talk to them about research that we know that people that you're serving are more likely to talk about their sexual experiences if you bring it up in the conversation. Does that make sense?
Yeah.
So we have multiple surveys that people living with HIV answer each year, and people in case management answer. So we learn a lot from that, and we try to educate our providers. There's also been a survey for providers around the state, and so we know what they want. And two of the things they want is learning about stigma and health equity. And so we are trying to jump on that and get out there in the community to do that hard work. Some places, some people just haven't had the experience in their life to be around people that are different than them. And so I try to bring that experience to them just by doing activities and talking about who's in their community. People need to get to know themselves and their culture, and be vulnerable with themselves, and then they can learn about the people that they're trying to serve or living around and working with. And then hopefully that will take them to the next step of being curious and wanting to learn about the people they're serving, which will then build relationships and rapport. And also encouraging people to be in community. Like if we have any professionals here that, it's just important to be in the community to interact with people. And so we try to encourage that sort of stuff. But I don't know.
And Alicia, so again, your organization helps provide resources and support for those living with HIV. Did I misspeak?
Yep, that's okay.
Oh, gosh.
I can.
Okay. I'm sorry.
It's okay. The case management services,
Yeah.
the Ryan White Case Management, they serve people living with HIV.
Okay.
The people I work with, New Cara Capacity Extension Program, alongside the Bureau of HIV, STI, and Hepatitis, we provide education to professionals around HIV, STIs, and stigma to try to improve services for people living with HIV and BIPOC populations, LGBTQ communities, and other people with barriers.
Awesome. Okay. Thank you for that.
I just had a backup I wanted to ask too with that question. It was just a resource. You're familiar with Dr. David Williams, Doctor of Public Health at Harvard University.
I'm
Dr.
not.
David Williams.
Okay.
He has a lot of literature out, and you can, he's on YouTube too. And he provides a lot of information about people with disparities and dealing with those particular issues that we're talking about.
Yeah,
Awesome.
thank you.
Thank you so
I will
much.
write that down.
Thank you. Yes. We have a question in the back.
Yes, I have a question. When you talk about your panels and health equity, has it ever come across about workplace discrimination? As far as those uneducated people that are in the hiring office, or those that are afraid to hire those people with HIV because they're uneducated, that uneducation runs into kind of discriminatory? And what conversations are being made to stop workplace discrimination versus stigmas? Because that kind of, if that person has that stigma, then it runs into discrimination.
Yeah. Great question. Thank you for that.
So in the realm of work that I do and the team that I work with does, we don't we don't focus on like the hiring and that part of the clinics and the places that we visit. My coworker Akoshua does do some of that work with subrecipients, which means the agencies who serve people living with HIV. We also recently took people that influence the hiring and the retention of staff. We took them with us to a health equity conference this year to try to help support them in their education and their work to try to help hire and retain a diverse group of staff. And so I don't really have a great answer for you because that's not the work, that I focus on, that level, but it's absolutely important.
But as an HR professional, recruiter kind of person, I really do appreciate that question, because even though, my business partner is here, then we do put on health equity conferences. That actually inspires me to want to bring that more to the forefront, right? Because that you're right, because the stigma does lead to discrimination, and that basically creates an opportunity to shut out talented individuals from taking care of their families. So thank you for that question. Yep.
Akoshua might want to say something.
Yeah. So I do as Alicia said, I do the health equity work for staffing. And I can say for our case management and ICS site, I do it for our internal staff, so the bureau and our capacity extension. For those external sites, it's a little bit of it takes a lot of steps to get there, to get people to understand what it takes to support marginalized people with lived experience, marginalized people, because it's like you can bring them in, and I've seen it happen where people who are hired who are living with HIV have not been supported in the way that they need to be supported. And so a lot of the groundwork is really getting people prepared to support those that staff who need that extra education, who need to understand that there may be conflicts that arise because the community is small of people living with HIV, and so you might know the person that you're working with, and then things come up, and so there are a number of things, and so laying that foundational educational piece of exactly what are the things that come up, what do you need to understand to fully support and understand these people as your employees, and to lift them up, and to really just be able to grow them in the field. And so that's the initial work that we're doing to eventually get to that point where we can hire more people with work experience.
Awesome. Okay, so we're doing a little tag team action here.
Oh, okay.
And I'm going to pass the mic over to my good friend Corey here.
I didn't think I would have the podcast today. So here I am. Let's give a round of applause to Larry Twitty Jr. Thank you so much. You mean so much to me.
Go Johnston.
I do have one question for you guys all before we get going. We know all the places where people can find resources here in Des Moines. Some of them are here today where they can find resources for HIV, STI, hepatitis, and things of that nature. But how can we utilize our maybe non-traditional areas, like the slowdown? If you look at any of the things here, they are very aware of the community, and you have the opportunity to have things here. But how can we utilize the community to where we can get more awareness out there around HIV? Community, small businesses, and things like that.
I think just collaborating like this, connecting with small businesses, having gatherings like this, bringing people together. I noticed when I came in here, they have a little library over there, putting books in here that people living with HIV have wrote, or, find me on Amazon. You can put a couple over there. But yeah, just putting people living with HIV and lived experience in places like this. Most of the time we love to have the conversation. Why not? We didn't know about it when we first contracted it, but living with the virus, you learn so much. And when you think about the people around you in your community, you want to make sure that you can give them this information so they're not being put in a place that you were put in when you found out. So just collaborating and connecting and getting to know the people who have small businesses that want to meet you where you are to do things like this.
I would say put information up also about HIV or about events like this that are happening around the community, so you can help spread the word about good things happening around town. I don't know.
Well, and let me just give you some more context why I'm asking is because I don't know the exact numbers right now, but I'm sure there are a lot of people that are living with HIV that don't know it because they're not they don't have a primary care provider. They're not getting their yearly checkups. Maybe they're uninsured or underinsured, and they don't utilize some of the resources that they may have, but they go to a coffee shop, they go to the library, they go to the grocery store, and if they have the opportunity to see it, that may make it easier for them to be able to say, hey, maybe I should go get tested. Does that make sense?
Yeah. So I was at a Domestic Violence Awareness Month with the Iowa Coalition Against Domestic Violence, and Primary Healthcare was there with their mobile unit providing testing.
I was just about to say that about the project.
Wonderful.
Because the project has
Okay.
one too. So I'm like connecting with space nonprofits like that. At the project, they pull up at the bus lots, the bus stations. They will pull up to your house if you don't want to come outside. They have this van it's literally a clinic just inside of a van, so you don't have to be in spaces that you're not comfortable in. So they can pull up in front of this coffee shop, and there could be an event out here, and you can step right outside for 10 minutes and go get tested and come right back in and keep turning up. They go to gay bars in Davenport downtown, so they can have their fun, but you can also come out here and get tested. So doing things like that.
Yes, thinking outside the box. I really appreciate that.
Invite testing sites to your
events.
To your events. Yeah.
Right, and that's what I'm saying is like, where do people find that resource to be able to say, hey, I want to have that here,
Yeah.
but where do I go?
On StopHIVIowa.org, you can find testing sites across the state.
Yes, and I will make sure to have all those links in the description of the YouTube episode and on all audio platforms. So you don't have to memorize where that's at. It'll be there. So that'll be good. Thank you so much. So this is the end of our conversation. I want to say thank you so much to our guests. Are there any last words that you have that you want to give to the audience that is here, to the thousands of people that will be listening to you later on? What would you have to say? You can look right in the mic.
Oh, look right in the camera,
No,
huh?
you don't have to. I'm messing with you.
Just go get tested. Know your status. Black communities, Black women. I love Black women. Go get tested. We're some of the highest numbers. Literally, go get tested. It takes 10 minutes. You're not alone. If you need somebody, DM me. I'll answer. I promise. Sometimes it might take a couple days, but I'll answer. But just go get tested. We all need to know our status, and you can't set expectations on other people. You can be married, you can be in a committed relationship, but you're not with that person 24/7. So if you know your own status and you're taking care of yourself, then you know for sure you're good. So just go get tested.
And I would say thank you. Thank you for taking the time to listen, to be here, to ask questions, to challenge us. Thank you for taking the time to educate yourself and continue these conversations with the people that you know. I really, really appreciate it. It's definitely a conversation that we need to have more with more people. So I would just say thank you.
Awesome. Well, thank you both for being here. Everybody, thank you for watching and listening to the My City, My Health podcast. You can listen to this podcast on YouTube, and you can download it on any major audio platform that you utilize in application. The resources and the tools will be in the link to the link to them will be in the description of this episode. We got to do this work together, and we're doing it one conversation at a time. So thank you so much for listening.